A kid who does not speak at expected age is called nonverbal kid. The most common cause of nonverbal kid is autism spectrum disorder. It is represented in 30% of cases. Another common cause is language delay, 25% of cases, hearing impairment in 20% of cases, selective mutism in 15% of cases, and apraxia of speech 10% of cases. Let's start with autism spectrum disorder. The hallmark of the disorder is challenging social communications and interactions, repetitive behavior, and restricted interest. Avoiding eye contact is represented up to 90% of cases. So kids with autism spectrum disorder avoiding eye contact. Repetitive behavior also almost in 90% of cases. Hand flapping, rocking, or engaging in specific routines are very common. Hand flapping is like this when they doing like this. Rocking is, for example, like this. Rocking movements or other specific routines they have. Difficulty understanding social cues, almost 90% of cases also. It means they can't understand your emotions from your facial expressions or your voice tonality. They can't understand. And they have restricted interest in many cases. In case of language delay, it means kids have late development of language skills compared to age-appropriate milestones, including understanding and expression. Difficulties in forming words, it represented in 60 to 70% of cases. Also, for such kids, are difficulty to understand other people's talking, and it's important characteristic also. Hearing impairment. Most common hallmark of hearing impairment is difficulty hearing sounds or understanding speech. Now let's discuss risk factors. Risk factors of autism spectrum disorder is genetic factors, older parents, and prenatal exposure of certain medications. Risk factors of language delay is family history, prematurity, exposure to multiple languages is also important, and excessive screen time. Excessive screen time is important risk factor because it is associated with language delay, no very direct correlation to autism, but there is important correlation with language delay. Risk factors for hearing impairment is genetic factors, prenatal infections, and exposure to loud noises. Selective mutism is condition where kid is mute in certain situations, but she or he can speak in specific situations, and it is most commonly associated with anxiety disorder, family history, and other environmental factors. Behavioral therapy, speech therapy, and medication for anxiety in many cases is important and have also favorable effect. Apraxia of speech is difficulty to coordinating speech muscles. So these kids cannot coordinating their muscles because of different problems. It can be because of brain injury, it can be genetic factors or neurological conditions. Treatment here is speech therapy and augmentative and alternative communication devices. It helps also. Most of these 5 conditions, prognosis is favorable, but early intervention is critical and crucial. So no matter what problem kid has, it's autism spectrum disorder, language delay, hearing impairment, selective mutism, or apraxia, early intervention is crucial. Now let's discuss distinction between autism spectrum disorder and language delay, because in many cases parents are wondering if their kids have autism or just language delay, because sometimes they have important intersections, and kid can have both at the same time, autism and language delay also. And more distinctive for autism is difficulty with social interactions. It's very important. And understanding social cues. Such kids can't understand other people's facial expressions, other people's happiness or madness, or other expression, or voice tonality. Restricted and repetitive behaviors, as I told you, like hand flopping, restricted interest or activities, and avoidance of eye contact, and sensory sensitivities. Such sensory sensitivities can be because of touch, can be on smells, can be light. For example, they don't like when lights on, or it can be otherwise. It can be hyposensitivity and hypersensitivity also, both. And in case of language delay, limited vocabulary for age, difficulty combining words into phrases or sentences, problems understanding spoken language, and trouble following directions are also common. So, not all cases of nonverbal kids are because of autism. Many cases it's because of language delay, but sometimes both occur same time. That's all. Thank you for your time. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.